Hello folks, this is Dr. Miller here. Just wanted to check in with you. Today I'm just coming from my home office in between seeing patients, and I just wanted to answer a couple questions that a lot of people have when it comes to different medications, especially metformin and diabetic medications. I help a lot of people that have been diagnosed with diabetes resolve their disease process by naturally addressing why they got diabetes in the first place. And so but before I go on, I'm not here to discuss whether medication is good or bad. Now, my approach to treating people's dysfunction, I don't use medication because I understand that the medication doesn't necessarily cure anything or treat the cause of why somebody's having a symptom. Medications are just designed to temporarily drive a symptom down to keep that person from having any kind of dramatic effect from the abnormal symptom. Now, using medications temporarily to drive down things like high blood sugar, high blood pressure, high cholesterol, to temporarily reduce your risk for a heart attack or a stroke, I am all about that, right? And so thank God we have those things to temporarily keep you under control. But it makes no sense to me as a long-term approach. And matter of fact, it makes no sense because the results are just horrible. You know, we see diabetics in our country, we see them get worse with time. And the standard of care with a diabetic is over time, we typically see you need more medication to control those blood sugars, eventually leading to insulin injections. We see you guys gaining more and more weight, having less and less energy. And then we see you guys reach the complications of the disease. And so we see diabetics losing limbs, going blind, having heart attacks and strokes, going on dialysis because their kidneys are shutting down. Overall, we're seeing the life expectancy of diabetics much, much lower than the average person. And so when it comes to taking a medication, you know, the approach to just take a medication and continue to take medications without changing the way you eat, without changing your exercise activity and regimen, it's just not going to produce a good result at the end of the day. Now, metformin is a medication that, it was originally studied for blood sugar. And what they're doing with a lot of different medications nowadays is they're writing them as what's called off-label. And so what that means is they're studied for condition A, but because they may help with condition B and C, they're going to also be able to prescribe that medication for that. And so, we're seeing metformin used for not only diabetes, but we're also seeing it prescribed for things like PCOS and hormone imbalances that are present with women. And the other big thing I'm seeing, a lot of questions with my other YouTube videos, a lot of questions are saying, well, my doctor told me that it's going to help me lose weight. And in fact, I've already lost a few pounds, and so I'm really excited about that. And it's just a big concern because, first of all, the people that I work with, I want them to understand that, weight is a result of your body not functioning properly, your metabolism not working properly, you not eating correctly. Weight is a result of dysfunction inside the body, whether it's your digestive tract, your thyroid, a lot of different things can cause weight, but some of the same reasons why you have blood sugar issues is why you have weight. So a lot of people are, they're lucky enough to find the solution to getting weight off, but the blood sugars are still elevated, and that's because the reason why they have diabetes is not the same reason why they have weight problems. And so, aside of that, metformin, the way metformin works, if you read the pamphlets, it does claim that it stops the liver from secreting abnormal amounts of glucose. And then the other thing it says that it sensitizes the insulin receptors on the cells, right? So insulin is the hormone that's secreted from the beta cells in your pancreas. And that insulin's, one of its job is to take the glucose or the sugar in your blood, and it's able to get it into your cells. Sorry about that, had a technical difficulty. But that is where the mitochondria, which is the powerhouse of the cell, that is where the mitochondria uses that glucose to make ATP. ATP is our body's energy. Okay, and so the reason why fatigue is the number one sign of diabetes is because your body's literally not making the energy it needs to function at a cellular level. And so what that drug does, what metformin does, is it forces more insulin into the system, which forces the cells to utilize that insulin to get the sugar out of the blood. Okay. Now, the reason why in a lot of cases you'll see so weight loss, and according to the studies that have been done by the drug companies, they claim anywhere from 2 to 6 pounds is on average what they saw with some of the studies that they did. But if you think about it, if you're not able to get sugar into your cells, the sugar stays in the blood, okay? And so what your body will do, because our bodies are brilliant, it knows that the more sugar that is in our blood, the more damage is going to occur, okay? A good analogy for high blood sugar is like a forest fire inside of our blood vessels. And so that's why it leads to organ destruction. That's why it burns up the nerves and causes neuropathy and nerve pain. And so your body wants to get that sugar out of your blood as much as possible. So if it can't get it into the cells where it belongs, then it's going to turn as much of that into fat, okay? Another job of insulin is to store sugar as fat so you can pull on that fat for later energy usage when you don't have available glucose, okay? The problem is that our American diet, we're constantly putting glucose into our body, right? So we never have a chance to pull on that fat. And so you become a sugar burner for energy instead of a fat burner for energy, right? And we can talk about that in a different video. But if your body now begins to get that sugar into the cells a little more frequently than it does to make fat, then your body's going to stop making as much fat, okay? And so the result of that is you're going to lose a few pounds, okay? But again, we have to look at the big idea. We have to look at long term. You go to the doctor, you're diagnosed with diabetes, and they put you on a medication. They tell you to lose weight, exercise, and improve the way you eat. That's pretty much the extent of the counseling that you get on that first visit. And as you're well aware, that's pretty much the extent of the counseling that you get throughout the disease process. And so what we need to do, what's normally done, is you just stay on the medication, but you don't change lifestyle, okay? See, we need to start thinking what caused my diabetes and what can I do to fix it. Now, I know we're told by a lot of your doctors and we're told by drug companies and pharmaceuticals, we're told that type 2 diabetes is irreversible. Now, again, I'm not here to debate whether drugs are good or bad, but I will tell you that it is impossible to reverse type 2 diabetes with the usage of symptom-suppressing medications. Okay, so by getting rid of a symptom via a medication does not mean that the problem is being addressed. Okay, and so what we need to do is we need to test to find out why you got diabetes in the first place. Okay, our motto in our office, the motto that I use and I've used for years, is we don't guess, we test. Okay, and so we need to find out why your body has lost control of blood sugars, and we know where to look. We need to look at your thyroid, your liver, your pancreas, and your adrenal glands, because those are the organs and glands that control blood sugar in the body. Okay, now in addition to that, we see a ton of triggers that promote the insulin resistance, inflammation being the number one trigger. Inflammation drives any disease process. Diabetics just have a ton of rampant inflammation in their body. That inflammation is driving their blood sugar up. It's driving their blood pressure up. It's causing joint pain and body aches and brain fog. It's leading to things like dementia, Alzheimer's, and Parkinson's disease. Inflammation is detrimental. And across the board, and everybody I've worked with, inflammation is one of the main issues when it comes to controlling blood sugar in the body. And so we need to test and see where the inflammation is coming from. We need to address that. And so again, it's a very comprehensive process that we go through in order to correct the metabolic dysfunction. Okay, by taking a metformin to temporarily drive down your blood sugars, yes, it's a great idea temporarily. Now, another effect of the metformin is it bullies some hormones. It bullies, because what we see with PCOS, we see a high testosterone levels and a lack of progesterone in a lot of women that have PCOS. And so that drug tends to drive those testosterone levels down, okay? But again, you have to understand there's side effects of every drug. When it's telling you that it's not allowing your liver to secrete proper amounts of glucose or excess amounts of glucose, in reality what that's saying is it's bullying the way that your liver functions. Now, your liver is your detox headquarters. One of the main reasons why people have inflammation that builds in their system is because they can't naturally detox. When your liver starts to be overwhelmed or stressed, your natural detox pathways start to shut down. Now, the liver does over 700 things for us every day. It's an extremely important organ. Everything that goes in your mouth, the first line of filtration is your liver. And so when you start to bully that organ, it's not a good thing, right? It's not a good thing, especially long term. This is why they say that it's a contraindication to use this medication if you've got any kind of liver disease or kidney disease, because it knows that a weakened organ it cannot handle that type of bullying or that type of stress on it, okay? But if it can't handle it when it's diseased, it's not normal for it to be able to handle it when it's functioning at a good level, because again, eventually what's going to happen, it's going to turn into a fatty liver or cirrhosis. It's just going to continue to beat up on your liver, okay? Again, guys, my approach, I look at it like the difference between a fireman and a carpenter, okay? My job is the carpenter doctor. Your pharmaceutical doctors, your medical doctors, the doctors that are giving you these medications to temporarily get you under control, that's like a fireman coming into a house that's on fire. Yes, we want to put the fire out. But when the fireman leaves, what is left? You're left with floors that you need to rip out, walls that you need to rip down, ceilings that you need to rip down, and then you need to rebuild that structure back to normal. See, the big idea, guys, is you were pre-designed at birth genetically to function perfectly. But because of lifestyle, diet, exercise, all those bad choices you've made, and maybe some things that you weren't taught correctly, right, on how to eat and how to do those things, that's one reason why we see these disease processes run in families, because a lot of families have similar lifestyles, okay? We need to address lifestyle. But see, diet alone is not going to reverse your disease process. Very rarely do we see diet and exercise remove or get rid of the disease. What we normally see is it improves sugar numbers, but because you have these metabolic dysfunctions that are not being addressed, you're not going to see we're not going to see you get completely off your medications. We're not going to see you normalize your blood sugars 100%. So if you're interested in getting more help with your diabetes, okay, the first process in my office is to fill out, it's a quite lengthy questionnaire. It's going to take you 40 to 45 minutes. I need you to do it all in one sitting, but that's just going to give me more information on what you're dealing with. I've got a ton of different testing that I do, and so I need more of an idea of where I need to start, okay? Here's the deal, guys. I have hundreds and hundreds of patients month after month come to me for help, and I would single-handedly help as many of those patients as I could. But the fact of the matter is a lot of those patients are not willing to do what it takes to get well. So many of you guys have lost hope that you're not willing to do what it takes to get well. You're so sick and tired of being sick and tired, right? You're so sick of medications. You're so sick of being told to exercise and you can't. You're so sick of being told to eat a certain way and you can't because you don't have enough guidance. And so by the time you come to me, you're not willing to do what it takes to get well. And so I tell my patients, I can't be more motivated than you in getting you well. Okay, but if your health is a very high priority in your life right now and you want to take the next step to being more healthy, starting to remove inflammation from your bodies, giving your body the ability to heal again, then what I need you to do is, in the link below, you'll see my email. Okay, it's ReverseTheDisease@gmail.com. That is where I will forward you an invitation to perform my questionnaire online. Okay, there's also a free report that I give out on diabetes. If you're interested in receiving a free report, when you email me, just email me free report, and I will send that free report over to you. Okay. Listen, guys, it's a pleasure speaking with you. I hope you got some good information. I hope this kind of just gives you some tips that you can do to start living a healthier lifestyle. I want to talk to you more about exactly what kind of exercise you need to do in order to be healthy. Not all exercise is good for you, right? We want to make sure that you're putting a healthy stress on your body. I want to talk to you about diet. Diet is extremely important, and everybody watching this video needs to eat slightly differently, right? So we need to find out what kind of diet you need to eat. If this video is helpful to you, please share it with all your friends. Please like it below. There's not a lot of people that know where to go get true healthcare and know how to go get healthy. And so please share this with your friends and family. Please like the video below. And I look forward to speaking with you again. God bless. Bye-bye.